Hola, muy buenos días a todos. Bienvenidos a esta sesión informativa semanal sobre la pandemia por COVID-19 en la región de las Américas. Soy Sebastián Oliel del Departamento de Comunicación de la OPS. Hoy estamos transmitiendo en vivo esta sesión por Zoom. Tenemos interpretación simultánea al inglés y al español. Ahí debajo de la barra un botón donde pueden optar por la interpretación o por el idioma sobre el que hablan nuestros voceros. También podrán hacer preguntas en el botón de la barra de abajo que se llama Q y A. Esta sesión también puede ser seguida a través de las redes sociales de la OPS en Facebook, Twitter y YouTube. Les recordamos que la sesión va a durar alrededor de 45 minutos y tomaremos preguntas hasta ese momento. Hoy nuestra directora, la doctora Carissa Etienne, les informará sobre la situación actual de la pandemia en la región y sobre el impacto que está teniendo en la población en situación de pobreza y en los grupos más vulnerables. La acompañan Jarbas Barbosa, subdirector de la OPS, Ciro Ugarte, director del Departamento de Emergencias en Salud, Marcos Espinal, director del Departamento de Enfermedades Transmisibles, y Silvana Digiri, director adjunto del Departamento de Emergencias y gerente de incidente para COVID-19. Ahora sí, quisiera darle la palabra a la doctora Etienne para sus palabras de apertura. Doctora Etienne.
Thank you, Sebastian. Welcome, and thank you for joining us. As of May 18th, there have been more than 2 million cases and more than 121,000 deaths due to COVID-19 reported in the Americas. This represents a startling increase of 14% for cases and for deaths from just last week. As the curve of the pandemic flattens or falls in other parts of the world, the virus is surging across our region. We are increasingly worried about the poor and other vulnerable groups at greatest risk of illness and death from the virus. The recent spike in cases and fatalities is partly due to the virus taking root in these groups. This includes indigenous groups living in the Amazon basin, which is home to over 2,400 indigenous territories across 8 countries. These groups live in both isolated villages with minimal access to health services or in densely populated cities, such as Manaus, Iquitos, and Leticia. We have already confirmed 20,000 cases of COVID-19 in the provinces that form the Amazon basin, where the incidence tends to be twice as high as compared to other states in the same countries. Without immediate action, these communities will face a disproportionate impact. If we want to slow the spread of the pandemic and put our region on a path to recovery, we must protect vulnerable groups from COVID-19. We must work together unrelentingly and with great speed to provide the resources and support that they need to fight the virus. Last week, I warned that COVID-19 has forced us to address 3 different but interrelated emergencies: economic, social, and health emergencies. Protecting vulnerable groups is central to addressing each of these. Our region is home to high rates of inequality, with many communities disproportionately affected by poverty and ranking low on the Human Development Index, even within middle-income countries. These communities struggle to access adequate health services and sanitation. We are also a highly urbanized region, with many people living in dense neighborhoods. Poor social and economic conditions provide a fertile breeding ground for COVID-19. And it is no surprise, therefore, that these communities are among the hardest hit by the pandemic. They are also less resistant to the economic shocks of of parents being out of work and children being out of school. I also want to highlight a few specific groups that are at great risk due to social barriers and thus require specific policies to protect them. Women. Women are disproportionately affected by health crises, and this pandemic has been no different. Women in our region face income disparity, lack of adequate access to health services, and are often subject to gender-based violence. In addition, women make up 70% of the health workforce in the Americas. So that is to say that they are on the front lines of COVID-19 and are disproportionately affected. People of African descent in Latin America struggle to access appropriate care in normal circumstances, a reflection of structural discrimination and racial inequity. These conditions put them at greater danger of contracting COVID-19, and they face the most severe consequences of the disease. Indigenous populations, as I mentioned before, face high rates of food insecurity, type 2 diabetes, and are affected by endemic diseases such as TB and malaria, which make them more likely to suffer the burden of this pandemic. When they live in isolation or remote areas, they face challenges from the interactions with non-Indigenous groups who may be carriers for COVID-19 and other diseases, and at the same time will struggle to access health services in both small villages and large cities. COVID-19 is spreading rapidly through our prisons, where overcrowding and poor sanitation make it difficult for prisoners to protect themselves from the virus. The same is true for migrants living in temporary settlements or in the process of migrating, where access to healthcare services is very often limited. Lastly, people with underlying health conditions are particularly susceptible to hospitalization, severe illness, and death due to COVID-19. Unfortunately, almost 221 million people in our region are at increased risk because they have an underlying condition, including people with non-communicable diseases such as cardiovascular diseases, obesity, and diabetes. These groups are not only vulnerable to the virus, but will face disruptions in treatment and care for otherwise manageable diseases due to the overwhelming of health systems. Protecting vulnerable groups is critical to addressing the health, social, and economic emergencies and winning the fight against COVID-19. It's necessary because we can't stop the spread of the virus if we don't focus on all those affected by it, including vulnerable population. It's also our responsibility because everyone has the right to health, to access testing, treatment, and care, regardless of who they are or where they live. First, we need to improve access to the public health measures that we know are effective, and we need to implement them aggressively, especially in areas with a higher risk of transmission. PAHO has issued clear guidance for countries on what works and should be done in each setting. And our teams are actively supporting implementation throughout the region. Second, all countries must strengthen health system capacity to better serve vulnerable communities. During a pandemic, we must overcome the structural inequalities that limit access to services. This means establishing mechanisms that support universal access to health, regardless of income, pooling of resources with the private and not-for-profit sector, eliminating payment at point of service, and setting up emergency hospitals that add surge capacity where it is most needed. These measures will not only improve access to health services today, but will lay the groundwork for faster, more equitable delivery of health innovations tomorrow, including new tests, treatments, and a future vaccine for COVID-19. Third, we must institute strong social and economic protections to safeguard the most vulnerable. With school closures, rising unemployment, and a slowdown of the informal economy, many are struggling to make ends meet during the pandemic. Our region has good examples of successful social protection programs, and we should be using them extensively at this unprecedented time. Far too often, we fail to prioritize the health and well-being of the most vulnerable among us. This must change if we want to stop the spread of COVID-19 and at the same time be ready to face future pandemics. It is only by ensuring human rights for all, when all peoples have universal access to health and its socioeconomic determinants, when we guarantee social protection for the vulnerable, and when our economic development addresses the eradication of poverty and the achievement of the Sustainable Development Goals, only then will the world be prepared to face future pandemics. But we need to begin this work now. Thank you.
Muchas gracias, doctora Etienne. Vamos a comenzar ahora con las preguntas que hemos recibido por correo electrónico y luego pasaremos a preguntas del chat, así que recuerden que pueden escribirnos allí en el botón de Q y A y las iremos tomando y respondiendo. Y por favor les pedimos que se identifiquen con su nombre y medio de comunicación a la hora de hacer las preguntas. Primera pregunta entonces nos llegó de Guillermo García de la agencia EFE. En inglés pregunta, recently the US pulled his funding to the WHO and now is threatening to do it permanently. How is this impacting the PAHO work during this pandemic, and which could be the impact for PAHO if the US stops sending funding to the WHO permanently? Doctora Etienne.
Thank you for this question. PAHO hopes that we will continue collaboration with the United States and all of our other allies. As I said before, governments of the Americas formed PAHO in 1902 in response to disease outbreaks, infectious diseases like malaria and yellow fever, which were interrupting trade. It is important to note that the US was a founding member of PAHO. When WHO was formed, the countries of the Americas decided to maintain this unique identity of PAHO, while at the same time agreeing to serve as the WHO Regional Office for the Americas. Some 60% of PAHO's assessed contributions comes from the US. And this has allowed us to support a range of public health programs, to address vaccination programs, and to work together to confront communicable diseases like malaria, TB, and HIV/AIDS, and to fight outbreaks like measles, yellow fever, dengue, Zika, and now COVID-19. This mutual collaboration with the US has advanced through the years, and we do look forward to our future collaboration. Let me also take this opportunity to tell you about how early PAHO has reacted and responded to COVID-19 in the Americas. Our agility in the face of outbreaks has been built over time. On the 2nd of January, we received an email to all WHO IHR focal points from WHO headquarters, which listed the cluster of pneumonia of unknown origin reported by WHO China office. On January 5th and 12th, under the IHR requirements, WHO headquarters shared the information with all WHO member states. On January 16th, PAHO issued an epidemiological alert to all of member states of PAHO, with information about COVID-19 and recommendations for member states. On January 24th, in my capacity as director of PAHO, I sent a letter to all ministers and secretaries of health and high officials, sharing key considerations and information regarding the emergence and spread of the new coronavirus that was circulating in China and the important implications for the Americas. On January 28, I declared an internal disaster, activating all PAHO's emergency procedures, reprogrammed funds, activated all country offices' response plans, expedited needs assessment, and prioritized technical cooperation for country readiness. We organized technical missions to countries, supported member states to update pandemic response plans. We developed and applied a modeling guide for planning purposes and provided lab test kits, swabs, and probes, and trained lab staff. We also trained frontline staff, including health personnel, and we held risk communication workshops. Since then, we have distributed PPEs, personal protective equipment, and other equipment, lab tests for 3 million reactions. We've issued numerous guidelines, technical briefs, and held many webinars. And all our country offices are working with member states in Latin America and the Caribbean to plan, implement, and support the response in every country. This is supported by our headquarters in Washington and WHO in Geneva. All of this costs money, and we rely on our donors to help us, including the United States of America. So let me just reiterate that we are all in this together, and it is only together that we will achieve success. And I do look forward to continuing our work with all member states during this pandemic and beyond. Thanks.
Gracias, doctora Etienne. La siguiente pregunta nos llega de Sara Morales de Hispan TV y dice: México acaba de aportar 1 millón de euros para entrar en un equipo internacional liderado por la ONU y la Unión Europea que investiga y busca desarrollar la vacuna contra el nuevo coronavirus. ¿Cómo ven las posibilidades de los países más vulnerables de la región para conseguir la futura vacuna? ¿Y qué dificultades se registran actualmente para acceder a pruebas, insumos y medicamentos para abordar la pandemia en los respectivos sistemas públicos de salud, además de qué está haciendo la OPS? Doctor Barbosa.
Gracias, gracias por esa pregunta. Los países de América Latina y del Caribe tienen un rol muy importante y México, como usted ha mencionado, ha propuesto incluso una resolución en Naciones Unidas. El presidente de Costa Rica también es uno de los líderes de este movimiento global para garantizar el acceso equitativo a las vacunas, a los medicamentos, a todas las herramientas esenciales para responder al COVID-19. En ese momento tenemos más de 100 proyectos de desarrollo de vacuna. Algunos ya empezaron los testes en humanos, algunos ya concluyeron la primera fase de los ensayos en humanos, que es la fase 1. O sea, se puede tener como un resultado de esa cooperación global una vacuna en quizás un año ya disponible para empezar a se fabricar. La OPS ha trabajado con los socios internacionales sobre el tema de la vacuna para garantizar que los países de la región tengan acceso a la vacuna cuando esté disponible. No podemos permitir que el acceso a la vacuna pueda estar relacionado con la capacidad de pago de un país. O sea, es muy importante, como uno de los pilares de nuestra organización, la solidaridad, hacer con que todos tengan acceso cuando esa vacuna esté lista. Así que es importante la acción de México, de Costa Rica y de todos los países de esa región. Muchas gracias.
Bien, gracias, doctor. La siguiente pregunta es de Laura Sepúlveda, de La Voz de América. Dice, la Universidad de Yale en un estudio destacó que hay países pobres que han adoptado el modelo de manejo de la crisis de países ricos, lo cual golpea más fuertemente su economía. En el criterio de la OPS, ¿Se está dando un manejo correcto a la crisis en la región? ¿Podría manejarse mejor en una segunda ola de este virus? Doctor Espinal.
Muchas gracias por la pregunta, Laura. La OPS considera que la región está dando los pasos necesarios para manejar la crisis. Siempre se podrá mejorar y hay países que tienen diferentes modelos. Un solo modelo no aplica a todos los países, porque tenemos países de renta alta, de renta media y de renta baja. Tenemos que entender, y es muy claro, que algunas de las medidas son más difíciles de aplicar en países más pobres. No es lo mismo el distanciamiento social en barrios o conglomerados o favelas, donde la gente vive muy aislada en algunos casos. Entonces, es importante que se tomen medidas. Pero para eso, los países han implementado diferentes medidas. Algunos han implementado cuarentenas parciales, se han hecho cordones sanitarios en diversas ciudades. O sea, es importante aclarar que las medidas que recomienda la OPS y la OMS son medidas aplicables y que se pueden adaptar a todos los países del mundo. Las medidas de educación como lavado de manos, las medidas de distanciamiento social. Es recordar que es toda la sociedad que tiene que poner parte de esto. Así que cada país adopta su modelo y para eso la OPS los asesora y está en comunicación constante a través de sus expertos todo el día durante los 7 días de la semana. Muchas gracias.
Muchas gracias, doctor. La siguiente pregunta viene de Nona Vargas del programa Asuntos Centrales de Bolivia y también Valentina de Marval de AFP Factual nos escribió sobre este tema y dicen: en Bolivia hay un boom por el uso del medicamento ivermectina. Hay farmacias artesanales fabricando para consumo humano. ¿La OMS tiene alguna posición sobre el uso de este medicamento? Doctor Aldiguieri.
Gracias por la pregunta. La ivermectina se utiliza como antiparasitario. En la región de las Américas se ha utilizado en las campañas de eliminación para 2 enfermedades, la oncocerciasis y la filariasis linfática. Estamos al tanto, por supuesto, y dando un seguimiento estrecho a los estudios en curso con la ivermectina y estamos publicando de manera regular revisiones científicas en la página web. En el día de hoy, o con fecha del 15 de mayo, la última actualización que publicamos en nuestra página web, no hemos detectado en todos los artículos publicados beneficio como efecto negativo en esos estudios. Eso quiere decir que en este momento no es un medicamento que estamos recomendando como tratamiento de primera línea para la COVID-19. Sin embargo, los países pueden y los científicos pueden juntarse a estudios de investigación como el estudio Solidarity y para integrar pacientes en grupos de estudio clínico aleatorio en condiciones de hospitalización. Y eso es un principio que aplica a todas las nuevas terapéuticas que se están probando a nivel mundial como a nivel regional. Gracias.
Gracias, doctor. Vamos a pasar a la siguiente pregunta que nos llegó de Ivette Munguía del Confidencial de Nicaragua y también muy relacionada, pregunta de Lidia López de la Prensa de Nicaragua. Mencionan que 5 exministros de salud de Nicaragua, 600 médicos y el Congreso de Costa Rica han solicitado a la OPS actuar ante lo que mencionan la negligencia del Estado de Nicaragua frente a la COVID-19. ¿Cuál es la respuesta de la OPS? Preguntan. Y también mencionan estas periodistas que hay acusaciones de ocultamientos de datos y preguntan, ¿tiene la OPS algún mecanismo para exigirle al Estado mayor rigor en los reportes? ¿Y qué puede hacer la OPS ante esta situación? Doctor Ugarte.
Muchas gracias por la pregunta. Es muy importante conocer cuál es la situación de la pandemia en todos los países de la región y al mundo. El gobierno de Nicaragua tomó contacto con la OPS hace una semana, indicando que cumpliría su responsabilidad de informar sobre la situación de la pandemia a través del Reglamento Sanitario Internacional. También informó que permitiría visitar los establecimientos de salud y que proporcionaría información detallada sobre los casos y los fallecidos, confirmados y sospechosos, incluyendo detalles de sexo, de edad y de ubicación. Hasta el momento, ninguna de esas acciones se ha materializado, a pesar de los pedidos reiterados de la OPS. En ese contexto, y tomando en cuenta reportes no oficiales sobre el incremento de casos de fallecidos y de neumonías, la OPS ha renovado su compromiso de apoyar al gobierno de Nicaragua para reducir el impacto sobre la población y también ha continuado renovando, reiterando sus recomendaciones por escrito y verbalmente. En este sentido, creemos que si podemos analizar la situación dentro del país, podemos brindar una mejor cooperación. Mientras tanto, las recomendaciones que se plantearon hace más de un mes continúan vigentes. Gracias.
Muy bien, gracias, doctor Ugarte. Vamos a intentar ahora darle la palabra a una periodista a través del chat para que haga la pregunta directamente. Es Bárbara Fraser, que contribuye con Enlace y otros medios de comunicación. Bárbara, ¿nos escuchas? Puedes hacer tu pregunta.
Good morning. Thank you very much. I have actually sort of two questions in one. One is countries like Peru, there are some countries, including Peru, that are using antibody tests more than PCR tests as part of their case identification. In Peru, the ratio is approximately 1 PCR test to 5 antibody tests. I'd like to know how that affects the actual case, the understanding of the progression of the epidemic in the country when so many of the tests are rapid tests instead of PCR. And then once the country begins to lift the lockdown and open up again to economic activity, what kind of surveillance should be in place? What are the recommendations that you have about doing surveillance? How should it be done? Case tracking? How should countries prepare for case tracking and surveillance? Thank you.
Gracias, Bárbara. Doctor Barbosa, ¿puede tomar esta pregunta de Bárbara?
Yes, thank you for this question. Barbara, the recommendation is that we need to use the PCR tests so to confirm or discard the case. And the reason for this is that with PCR, we have almost 100% of sensitivity and specificity. With antibody tests, if we use them to confirm a case, some antibody tests can reach up to 75% of a false negative. And this is easy to understand. The human body will take some days to produce antibodies that will be detected for these tests. For these reasons, it's very important to use the PCR test. We know that many countries have faced difficulties to access these tests. The Pan American Health Organization, using international solidarity and donation in our emergency funds, has deployed more than 2 million tests to the countries in the Americas. We are also using our strategic fund, that is a regional purchasing mechanism, to purchase the tests. We have deployed also more than 2.5 million tests, PCR tests to the countries. So it's important to increase the access because, as you mentioned in your question, we need numbers that can be compared. If we have a positive case to a PCR test, it is totally compared to another positive case in the same condition. So we believe that with this effort from the countries, including Peru, to have more access to PCR tests, we can reduce the use of antibody tests and let them to sero-epidemiological studies that are also important to be performed in the countries to have measurements about what is the proportion of the population that have had contact with COVID-19. Thank you.
Gracias, doctor. La siguiente pregunta le vamos a dar la palabra también en el chat a Ariel Bowlet de Tribune.
Yes. Good morning. My question is related to hurricane season. It's mid-May and hurricane season is approaching June 1st. Is there a fear that there will be an increase in cases or a outbreak as with when a hurricane happens, people go to shelters in their close proximity, which can cause COVID-19 to be more contagious? And what recommendation modifications will countries need to be making in their hurricane preparedness plan to manage the crisis and reducing the level of infections?
Muy bien, gracias por la pregunta. Doctor Ugarte, ¿puede tomar esta pregunta?
Thank you for the question. Yes, hurricane season is approaching. And of course, hurricane season will present additional challenges particularly for the Caribbean countries. And our recommendations have been published through a document regarding hurricane provisions for shelters in the times of COVID-19. Basically, what we want to ensure is that the people and the communities and the governments update their plans, adjust their plans to the current situation, and maintaining the social distancing and other protective measures, also ensuring that the health services are fully operational so they can cope both with COVID-19 and the potential impacts of the hurricane season. We have to recognize that there are certain populations that, as the director mentioned, vulnerable populations inside the countries that need to be prioritized, including people with disabilities and others that may not be able to respond adequately in times of social distancing. And when a hurricane season comes, they may be more in danger, or they may need additional specific response. So with that, in that regards, the hurricane season is a situation that the countries also may highlight through the sectoral mechanisms that are, I'm sure, active for COVID-19 in all the countries in the Caribbean. Thank you.
Gracias, doctor. Siguiente pregunta que también nos llega por el chat y por correo es de Anthony Boadl, de Reuters News, Senior Correspondent in Brasilia. En inglés pregunta, what is PAHO's position on the wider use of hydroxychloroquine in this pandemic, as the Brazilian government is planning to prescribe? Dr. Espinal, can you take this question?
Thank you, Anthony, for this question, a very important one. PAHO's position is that there is no evidence to recommend hydroxychloroquine and chloroquine for use in COVID-19. We don't have yet results of clinical trials that suggest the efficacy of these two medicines. And in fact, from the very beginning, as the director mentioned, that PAHO was engaged with the countries since January. PAHO immediately produced a very thorough, systematic review about the evidence on these two drugs. And we just updated the document, and still there is no evidence to suggest that these two drugs are efficacious against COVID-19. The use in any country, it's a matter of the country deciding, but our recommendations are crystal clear that they should not be used yet. And in fact, current studies are suggesting high rate of secondary effects and cardiology problems in people who are using it. Thank you very much.
Gracias, doctor. Siguiente pregunta nos llegó hasta desde nuestros colegas de Ginebra y es del periodista Jamil Chade de Brasil, y también similar nos preguntaba Roberto Almeida del Instituto Socioambiental. Preguntan en inglés, what is the situation of the indigenous populations in the Amazon? Is PAHO discussing the possibility of classifying indigenous communities as a specific risk group in relation to COVID-19 pandemic? Dr. Aldiguieri?
Thank you for these two questions. So I will try to answer both in the same manner. Of course, as Dr. Etienne flagged during her remarks, we are talking about vulnerable population. We are talking about indigenous people, not only in the Amazon basin, but also in the islands of the Andes, also in Central America. But also we are talking about Afro-descendants minorities in countries of Latin America, and also in the interior of the countries of the Guyanese Shield, Suriname and French Guiana. These are very vulnerable population for different reasons. One of the first reasons is the challenge in terms of health promotion, in terms of community engagement that are triggered by the cultural barriers. So this population need special communication regarding the prevention and the implementation of public health measures. This is one aspect. The second aspect, which is complex, is that indigenous people are also living in big cities, and there are big cities in the Amazon basin. We are thinking about Manaus in Brazil, Leticia in Colombia, Iquitos in Peru, and many other places. And this population, in addition to have these challenges in terms of health promotion, accessing the information, are also living in poverty, very dense neighborhood, and also with comorbidities. And among this population in these big cities, there is a risk of amplification of the virus, and after a spread to the remote communities through the rivers and through the highways in the Amazon. At this moment, we have different red flags, hotspots. I'd like to flag, if I may, the tree border area between Brazil, Colombia, and Peru. But also, and in these areas, we are seeing the trends up with a high reproductive rate of the COVID spread. But also, we would like to flag other areas that are emerging during the last days and weeks in border areas between Brazil, French Guiana, and Suriname. So we must be in alert. We must consider these indigenous groups as vulnerable population and implement specific prevention and control measures to protect them from a high burden of this disease. Thank you.
Gracias, doctor. Tenemos varias preguntas vinculadas con México. Voy a hacerla en dos partes. Ana Portela del financiero Bloomberg México pregunta, dice que México ya presentó su plan de desconfinamiento gradual basado en un semáforo que indicará qué regiones del país pueden reemprender actividades en función del nivel de contagios. ¿Cómo ve la OPS ese plan? ¿Cuáles son los parámetros, criterios, datos, cifras claves a tener en cuenta a la hora de decidir desconfinar en todo o en parte una región? Pregunta Ana. Y también David García de Thomson Reuters pregunta lo mismo de cómo ve la OPS las decisiones del gobierno mexicano de reabrir gradualmente la economía. Dice él, a pesar de que hay una escasez de pruebas para COVID, y no se muestra todavía, dice, una tendencia hacia la baja en nuevos casos. Doctor Barbosa.
Gracias, gracias por la pregunta. Yo creo que todos los países están en ese momento revisando mucho la situación, cómo está de la transmisión y cuáles son sus planes para el futuro. No hay una receta única para todos los países. Tenemos que pensar cuál es el objetivo cuando se adoptan las medidas de distanciamiento social. Es reducir la velocidad de la transmisión para que el número de casos graves que son producidos todos los días no sobrepassen a capacidade de los serviços de saúde. É para isso que se adotam as medidas de distanciamento social. Então, para responder se devem adotar medidas mais fortes ou mais leves, se tem que responder e contestar primeiro a uma pergunta: como está a transmissão? Se há controlado a transmissão, ou seja, com testes suficientes para testar todos os casos suspeitosos, monitorear seus contatos. Se percebe que há uma redução de número de casos de maneira consistente por um período de tempo, isso se tem que monitorear de maneira, como se está fazendo em muitos países, em México também, de uma maneira regional, porque muitas vezes em um país a situação é distinta em uma província ou em uma municipalidade. Então, isso se deve ter em conta, primeiro. Se há uma segurança sobre o controle da transmissão, se deve começar com um processo planificado, cuidadoso, monitoreando muito bem, muito cerca, alguns indicadores. O primeiro é a própria dinâmica da transmissão. Se adoptam algumas medidas, por exemplo, regressar às classes, e se percebe que há um incremento de novo de casos, há que revisar bem o que está passando. Se é necessário, quizás, incluso, volver um passo atrás. Então, há que planificar, tomando em conta as medidas que são mais importantes para reduzir a carga sobre as famílias pobres, a carga sobre a economia, mas de uma maneira muito bem planificada e que se pueda ir monitoreando o que passa. Alguns países da Europa que começaram a transmissão antes de América Latina, começaram esse processo e estamos aprendendo com essas experiências. E sabemos que planificar bem, fazê-lo de maneira cuidadosa e monitorear a transmissão, por um lado, e por outro, como estão as camas de hospitais, de terapia intensiva, os respiradores, é um monitoreio diário que cada país tem que fazer para poder aplicar de maneira equilibrada, cuidadosa, as medidas suficientes para reduzir a velocidade, permitir que os casos graves possam ser tratados em los hospitales en ese proceso de una transición. Muchas gracias.
Gracias, doctor. La siguiente pregunta del chat viene de Jerry Díaz, de Catholic Media Guyana. Pregunta en inglés. Smaller countries in the Caribbean could be affected due to not getting essential supplies of testing kits, other essential medical and sanitizing supplies due to restrictions on exports from the USA and Europe. How are you able to give this priority for us in the Caribbean? Doctor Ugarte, ¿puede tomar esta pregunta?
Yes, we've been working very closely with the Caribbean agencies to ensure that the essential supplies arrive to the countries in need. Actually, we've been able to channel a lot of those supplies from other sources to the Caribbean countries. We understand that there are still several challenges, and we work very closely with the global supply chain of WHO and other UN agencies. And the Caribbean is one of the areas of the Americas that have been prioritized. And also, we recently signed an agreement with a security system in the Caribbean, so to be able to transport of those essential supplies and also to have a hub in Panama, so we can also distribute from Panama to the Caribbean and other countries in the Americas. Most of the tests have been supplied by PAHO directly through our procurement channels and also using the strategic fund, that is the fund that PAHO has to purchase medicines and essential supplies in the Americas. Thank you.
Gracias, doctor. Siguientes preguntas, de alguna manera relacionada. Jacqueline Charles del Miami Herald pregunta, does PAHO know how many incidents of discrimination and stigma that has taken place in the region, and how is it impacting the response? Any places you are deeply troubled by? Pregunta Jacqueline Charles. Doctor Espinal, ¿puede tomar esta pregunta?
Thank you for the question. This is a very important question because the concern is generalized. It applies to everyone. We have seen stigma in the pandemic earlier, actually in some population groups. So it is important that education and the facts are shared with the population so they are well informed on what is not a fake news and what is a fact news. I think the issue of stigma has also a lot to do with populations living in conditions of vulnerability. And the director mentioned some of them already. PAHO just, it's advising countries and just issued a very comprehensive set of guidelines on human rights, gender issues, and ethnicity. And this document is available to all the countries. I think it is important that countries not only rely that because people who are going to be more stigmatized, not only population groups, but all those who suffer of COVID sometimes, and we have seen that. So the message is COVID doesn't has privilege to anybody. It could affect anyone, and it's a disease. So stigma is out of the question, and we recommend countries to work with us to ensure that the proper advice and the proper education programs based on the advice we give on ethnicity, gender, human rights, and key facts are spread among the population so they are well informed and ready to ensure that stigma is not a problem. But as always, there is a risk, and we need to watch carefully on this issue to prevent population groups being stigmatized and people affected by COVID. Thank you.
Gracias, doctor. Siguiente pregunta en el chat nos llega de Melina Ochoa de Uno Noticias TV. Hizo varias, pero una de las preguntas es, ¿qué opinan de que países de la región de las Américas usen la llamada inmunidad de rebaño contra COVID-19? ¿Funciona, doctor Aldilleri?
Gracias. Pregunta interesante. Definitivamente, la inmunidad de rebaño no es, buscar eso no es la estrategia que está recomendada por la Organización Mundial de la Salud, tampoco por nosotros. Los ejes y la estrategia de respuesta se basa en la detección de los casos, el aislamiento de esos casos, la identificación de los contactos, la cuarentena de esos contactos, el manejo clínico para salvar vidas de esos casos y la implementación de las medidas de salud pública con todas sus etapas, y es el camino que tenemos que seguir en esa región. No es buscar una inmunidad de rebaño que, la verdad, esas son palabras que no nos gustan, que no aplican realmente al ser humano. Gracias.
Gracias, doctor. Esta pregunta nos llegó de Manuela Andreoni del New York Times. Dice en inglés, in Brazil, local officials have been finding it hard to convince people that they should stay home. What advice does PAHO have for those officials? Quizás doctor Espinal puede tomar esta pregunta.
Thank you. Yes, the advice is to have consistent messages to inform the population and the people. But when the messages are not consistent and different, then then there is a problem and people don't know where to go or what to accept. And it is important that countries make their message consistent with the recommendations of international experts based in PAHO and based in WHO. The policy of these two institutions are very clear, and my colleague, Dr. Aldigueri, just mentioned about how to address the epidemic. If we recommend non-pharmaceutical measures like social distance, well, social distance needs to be implemented. It doesn't need to be social distance 24 hours or curfews of 24 hours. Countries use different approaches, but the messages are very important. And if in countries where there are no consistencies, it is that remains a problem, and it's a problem that needs to be addressed, because it means more cases and it means potentially, as we are seeing, more death. So we keep recommending consistency, risk communication according to international standards, and the whole package of that PAHO recommends for addressing the epidemic to be implemented. Thank you very much.
Gracias, doctor. Hemos llegado casi al final de esta sesión, así que vamos a pasar a la última pregunta que nos llegó de Rodrigo Caetano de Exam Brasil. Pregunta en inglés. COVID-19 revealed the necessity of a universal health system for all countries. How to create such system and how to balance public and private interests regarding the health market. Dr. Etienne.
Thank you for this question. I agree with you that the COVID-19 pandemic has reinforced the urgency with which we must strengthen and transform health systems to achieve universal health coverage and universal access to health. Emergency preparedness and response will only be effective if our health systems have the capacity to address the needs of all, and especially the most vulnerable within our societies. An emergency response can only be built on a system that is adaptive and responsive to the needs of all, where barriers to access, be they financial, cultural, or geographical, have been eliminated, and where primary healthcare is and has been the foundation on which the health system has been built. In the Americas, our health systems remain highly segmented and fragmented, impacting access to healthcare in normal times, and therefore impacting the emergency response in times of a pandemic. Our health systems have not received the financing that is necessary to ensure universal health within the region. And financing must be solidarity-based and must protect people from catastrophic expenditures and impoverishment. Poorly organized, poorly financed health systems in normal times will never have the capacity to respond to an emergency, impacting the outcomes of the emergency response and contributing to increased levels of vulnerability within society. And so as we respond to the immediate needs of the pandemic, we must be conscious of the need to reset policy, to transform our health systems and our social protection mechanisms to ensure universal health and social protection, and build resilience within our health systems and societies as we move forward. We must do so with an equity lens, addressing the needs of our most vulnerable populations. I need to say that we all have a role to play in this: academia, civil society, and the private sector, the media as well. However, it is the role of the state to provide leadership and stewardship in the transformation of our health systems and our social protection mechanisms, and to regulate the necessary processes, institutions, and sectors, including the private sector, to support the objectives of the transformation towards universal health. This is a priority for PAHO, And we will continue to provide support to governments in this key area of health systems transformation within the context of COVID-19 and beyond. Thank you for this question. It's together that we will overcome. Thank you.
Gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final de esta sesión. Enviaremos las palabras de apertura de la directora, así como la grabación de esta sesión por correo electrónico a todos ustedes, y pueden seguir en contacto con nosotros vía email, que les estaremos contestando a la brevedad. Gracias a todos y seguimos conectados. Saludos.